The outbreak of the novel coronavirus disease, commonly known as COVID-19 in December 2019, gave rise to an ongoing global public health crisis. It has been 2 years since the outburst, yet the global community is still suffering from it. In response to the COVID-19 pandemic, mitigation measures were enforced which affected the normalcy of people's life. Due to COVID-19, wearing masks in public is mandatory. People work from home instead going to office. Students are studying at home. Face-to-face interaction is minimized, hence there is excessive usage of gadgets. There is disruption of routines. There is isolation and quarantine in a long period of time. Social contact is lessened. People lost job and source of income. Prices of products and services are getting higher and higher. Only essential travels are allowed. Other leisure and outdoor activities are limited or prohibited. Studies said that the sudden and massive changes did not only affected the economy, job, education, and other activities and routines of people. It is also detrimental to mental health. During the pandemic, surveys show a major increase in the number of people who has mental health issues. Some of the common signs and symptoms determined are being afraid, paranoid, problematic, stressed, anxious, depressed, suicidal, lonely, and insomnia. People react and respond to the pandemic differently. Some are trying to be positive, while others are struggling mentally. Therefore, due to the massive intensification of mental health issues, a lot of approaches to manage mental health in this time of pandemic are being enforced. Mental health services are available anywhere. Webinars about mental health is being done everywhere. Different programs promoting mental health is being imposed. Government and policymakers are making and supporting programs about mental health. Hence, as an individual, keep in mind that mental health matters. Do not wait and rely too much on what the government, the policymakers, and the mental health services could offer to manage your mental health. Help your own selves in looking after your mental health in simple and easy ways. Here are some self-care strategies that are good for your mental and physical health, which can help you take charge of your life. First, take care of your body. Be mindful about your physical health. Get enough sleep. Go to bed and get up at the same times each day, even if you're staying at home. Participate in regular physical activity. Regular physical activity and exercise can help reduce anxiety and improve mood. Find an activity that includes movement. Healthy eating is also important. Choose a well-balanced diet. Avoid loading up on junk food and refined sugar. Limit caffeine as it can aggravate stress, anxiety, and sleep problems. Avoid tobacco, alcohol, and drugs. If you smoke tobacco or if you vape, you're already at higher risk of lung disease because COVID-19 affects the lungs. Your risk increases even more. Using alcohol to try to cope can make matters worse and reduce your coping skills. Avoid taking drugs to cope unless your doctor prescribed medication for you. Limit screen time. Turn off electronic devices for some time each day, including 30 to 60 minutes before bedtime. Make a conscious effort to spend less time in front of screens such as television, tablet, computer, and phone. Most importantly, relax and recharge. Set aside time for yourself. Even a few minutes of quiet time can be refreshing and help to settle your mind and reduce anxiety. Select a technique that works for you and practice it regularly. Second, take care of your mind. Reduce stress triggers. Keep your regular routine. Maintaining a regular daily schedule is important to your mental health. Set aside time for activities you enjoy. Limit exposure to news media. Constant news about COVID-19 from all types of media can heighten fears about the disease. Limit social media because that may expose you to rumors and false information. But keep up to date on national and local recommendations, and when you do it, look for reliable sources. Stay busy. Healthy distractions can get you away from the cycle of negative thoughts that feed anxiety and depression. Enjoy habits that you can do at home. Doing something positive to manage anxiety is a healthy coping strategy. Focus on positive thoughts. Choose to focus on the positive things in your life and maintain a sense of hope instead of dwelling on how bad you feel. Use your moral compass or spiritual life for support. If you draw strength from a belief system, it can bring you comfort during difficult and uncertain times. Set priorities. Don't become overwhelmed by creating a life-changing list of things to achieve while you are home. Set reasonable goals each day and give yourself credit for every step, no matter how small. Third, connect with others. Build support and strengthen relationships. Make connections. If you work or study remotely from home, or you need to isolate yourself from others for a period of time due to COVID-19, find time each day to make virtual connections by email, text, phone, or video chat. Enjoy virtual socializing and talking to those in your home. Do something for others. Find purpose in helping the people around you. Helping others is an excellent way to help ourselves. Support a family member or friend. If a family member or friend needs to be quarantined at home or in the hospital due to COVID-19, come up with ways to stay in contact. It could be through electronic devices or the telephone, or by sending a note to brighten the day. Fourth, avoid stigma and discrimination. The stigma can make people feel isolated and even abandoned. They may feel depressed, hurt, and angry when friends and others in their community avoid them for fear of getting COVID-19. The stigma harms people's health and well-being in many ways. Stigmatized groups may often be deprived of the resources they need to care for themselves and their families during a pandemic. Hence, people who are worried about being stigmatized may be less likely to get medical care. Those are some tips that you could do to maintain a sound mental and even physical health. Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, said that good mental health is absolutely fundamental to overall health and well-being, especially during this pandemic. Therefore, make your mental health a top priority during times of high stress and uncertainty. You may find that a few proactive measures will help you to feel much better, but if you don't feel like your strategies are working, then reach out to a professional. Talking to someone could be the key to helping you manage your distress during this pandemic. Always remember, prioritize your mental health for you to be holistically healthy. Keep in mind that mental health matters.